Hi, my name is Colleen Setzenpan, and Noreen Doyle and I will be presenting module number 7. This module will cover monitoring and assessment that will be affected by the policy changes. In this assessment, we will cover revised nursing assessment, incorporating NCI toxicity rating, missed patient appointments, and occurrence reporting. The objectives of this module include 6 elements to include when completing a patient assessment, demonstrating the use of the NCI toxicity assessment itself, reviewing documentation forms that have been updated, explaining the process if a patient misses an office appointment and whose responsibility it is to complete the process in the event of that missed appointment. And our last topic will be covering the purpose of using occurrence reporting. So first we'll start with patient assessment. When you're assessing your patients, we want the documentation to reflect changes in clinical status of a patient, their weight, changes in performance status, allergies, and previous reactions and treatment-related toxicities, psychosocial concerns, and address the needs of those for patients, current medications including over-the-counter, and complementary and alternative therapies. A new change will be any changes in a patient's medication needs to be reviewed by a licensed practitioner, whether it's a physician, a physician's assistant, or a nurse practitioner. Something that may be new to some of you is incorporating the National Cancer Institute's toxicity assessment. What it is an objective tool for healthcare providers to grade toxicities that can occur from treatments. They are a numeric grade that range from 0, meaning none or it does not apply to the patient, to 1 is mild, 2 is moderate, 3 is severe, or 4 life-threatening. Not every toxicity will contain a life-threatening side effect. The purpose of the grading is used as an indicator for adjustment of dosing, delaying treatment, or response to an intervention. This assessment incorporates 7 areas of body systems that can be affected. These 7 areas include bone and bone marrow, cardiac, constitutional, integumentary, neurosensory, gastrointestinal, and reproductive. We're first going to start with bone and blood and bone marrow, and you'll notice up here that there are 4 levels to this. Grade 0, like I mentioned earlier, means none or the patient is not experiencing it. Grade 1 is mild, grade 2 is moderate, grade 3 is severe, and grade 4 is life-threatening. As you can see under anemia, you look at the patient's lab values and you can base the grading of if they're experiencing anemia under that. Same thing with neutropenia, you want to calculate out their neutrophil count and thrombocytopenia. Cardiac is another area that is covered, and there are 2 areas specific to this. The first one is hypertension. The second one is hypotension. You will notice in some of these gradings, there will be something like a semicolon. It's also known as an M dash. What that means is the patient can have either of the symptoms listed here. They can have, for example, under hypertension, it says under the grade 2, they can have a brief episode less than 24 hours requiring fluid replacement or other therapy, or no physiological consequences. What that means is the patient can experience one or the other and still qualify for that particular toxicity grade. The third one are constitutional symptoms that involves fatigue and weight loss and weight gain, and you can see under those individual toxicities the criteria for which the patient would qualify. If a patient has, for example, a grade 2 fatigue, they would be moderate interference with their activities of daily living. Under weight loss, you can see the percentages that are incorporated in terms of grading that toxicity. You will note under weight loss there is no grade 4. Integumentary is the next one. You'll notice there we cover rash or desquamation. That would be particularly of interest for patients under experiencing bone marrow transplant. Patients experiencing nail changes, which is very common. You will notice, for example, under nail changes, the discoloration and that M dash again, meaning they can have discoloration or they can have ridging. that would still qualify them as a grade 1. They could possibly even experience both of those, but still would be considered a grade 1. The next one is acne or acneiform. The last one is hand and foot syndrome. And you'll notice they're very descriptive in terms of how to grade them. So it makes it clearer for anybody to, and more objective in terms of evaluating a patient's response. The next one is the neurosensory area. We look at anxiety, depression, you look at sleep, and you look at neurosensory areas. Again, there's certain areas that have M dashes under them, so they can either be asymptomatic for a grade 1, they could have loss of deep tendon reflexes or paresthesia, but it does not interfere with their functioning. Gastrointestinal, the next 3 slides will cover this. There's a lot to look at under here. We'll first start with anorexia. Again, you can have anywhere from a grade 0 to a grade 4 under this one. It can be as mild as having a loss of appetite to their oral intake is decreased, but it doesn't cause weight loss, to decreased oral intake with a significant malnutrition and weight loss, or it can be a life-threatening type of anorexia. Constipation, so the next one, you can have occasional intermittent symptoms, as you can see here, or it could be occasional use of stool softeners, laxatives, or they need to modify their diet to relieve their constipation. Diarrhea is always a big topic to cover, and it's difficult to grade. These are very specific under diarrhea. For grade 1, you have to have an increase of stools less than 4 per day to a mild increase of their ostomy compared to what is normal for them. Grade 2 is an increase of 4 to 6 stools per day over their usual. Perhaps they may need some IV fluids or not, but it's usually less than 24 hours. They may have an increase in their ostomy compared to normal, but it does not interfere with their activities of daily living. Grade 3 is 7 or more stools per day. They could also require or not IV fluids of 24 hours or longer in the hospital. A copious amount from their ostomy, and it does interfere with their activities of daily living. Diarrhea can be life-threatening, and the qualifier for this is it causes a hemodynamic collapse. Nausea is the next one under gastrointestinal. It can be as simple for a grade 1 as a loss of appetite without interfering with their eating, to decrease in their oral intake without weight loss, possibly some IV fluids. Again, there's an M dash in there, so they can have any of those to meet that criteria for grade 2. Grade 3 could be an inadequate oral intake. They could require 2 feedings or total parenteral nutrition of greater than 24 hours or more per day. Vomiting is pretty clear cut. For grade 1, it's an episode 1 time in 24 hours, 2 to 5 times in a 24-hour period. They could also potentially need IV fluids, but less than 24 hours. For grade 3 of vomiting, it is 6 episodes or more in a 24-hour period, and they would need IV fluids or total parenteral nutrition for 24 hours or longer per day. Mucositis is sometimes an area that's not always adequately assessed. They could have no mucositis. They could have just some redness of their mouth, or even just some oral soreness qualifies them for a grade 1. For a grade 2, they could have patchy ulcerations or pseudomembranous areas in their mouth, but they can eat solid foods. Grade 3 is a little more in-depth in terms of they have a lot of ulcers inside their mouth. They have maybe some minor trauma that occurs with bleeding from eating, and they can only take in liquids. Mucositis of grade 4 is very significant. They have spontaneous bleeding, they have severe necrosis inside their oral mucosa, and it can be life-threatening, and they are not able to take any type of intake orally. The last area that is not always adequately addressed is reproductive areas in terms of sexuality and libido. There's only 2 grades in this category. The first grade is a decrease in interest but not affecting the relationship. No intervention is required. Maybe the patient's not interested. Sometimes it's a very difficult subject to cover. And so it's something that we as healthcare providers need to address and ask patients specifically, because patients don't always bring this up. The grade 2 in reproductive is a decreased interest and it is adversely affecting the relationship with their partner. And perhaps that could indicate if a patient opens up that they do need some intervention. A last area of interest to note under toxicity grading is to have an active list of psychosocial and supportive services that is available to staff and patients. You may have one in your area that you work in. You may have social service resources. You can always access information under our intranet website. It is listed under each specific hospital website that we have. And all you have to do is go click under the Oncology Informational One-Stop Resource Center, and you will find the link to psychosocial and supportive services. At this time, I'm going to turn our presentation over to Noreen.
Thank you, Colleen. I will continue on by discussing the process for missed patient appointments and finish up by discussing occurrence reporting. Missed patient appointments are an important step at the end of the day process. Office schedules should be reviewed and missed patient appointments followed up by staff as identified. The front office is responsible for following up on physician visits, missed appointments. The medical assistant is responsible for lab draws, and nurses for treatments. The process, there's a 5-step process. The first is to contact the patient by telephone to identify the reason for the missed appointment. Remember to document the interaction in the medical record. Reschedule the appointment. If the staff member is unable to reach a patient, a list should be made and contact should be followed up by the next business day. If after 3 attempts to contact the patient you are unsuccessful, the staff is to notify his or her supervisor. Next, I will talk about occurrence reporting. When do you need to file an occurrence report? They are filed for any event not consistent with routine care, which either has or could have caused injury or loss to a patient or visitor, or which may give rise to a claim against the physician practice, hospital, employee, or member of the medical staff. The system is committed to patient safety, assuring an environment that encourages error identification. A proactive tool to improve patient safety and quality care through a team approach. And it assists to identify process improvements necessary, as examples would be in near misses, drug reaction, and equipment malfunctions.